Good morning, everybody. Thank you all for joining us. My name is Glenn Craig, and I'm the President and CEO of the Thunder Bay Regional Health Sciences Foundation. And on behalf of the Foundation and the Health Sciences Center, I want to welcome you to our facility today. It's my pleasure today to be here and being the MC as we announce our 2014 Family Care Grants. These grants are requests from our frontline staff who work closest with our patients every day, and these are the small items that really help improve that quality patient experience. To ensure that all these grants really meet that criteria, we encourage and make each grant application have a signature of a patient and family advisor, as well as their manager and executive vice president. This program started back in 2009 with an investment of $30,000 back then, and has now grown with the partnership with the Volunteer Association to Thunder Bay Regional Health Sciences. And we're very proud to say that we'll be donating $60,000 to the various programs today. I'd now like to call on Margaret Power, or Mrs. Power as I remember from Redwood Public School all those many years ago, to talk on behalf of the Volunteer Association and the Board of Directors.
Thank you, Glenn. I'm absolutely delighted to be here on behalf of the Volunteer Association to announce the recipients of the Family Care Grants. As Glenn mentioned, the Volunteer Association has provided funding for the program since 2011. And this year we were thrilled to be able to contribute $30,000 again toward this grant program. It's very encouraging as a volunteer to help raise the funds, and as a board member to be involved in the decision process. I'd like to thank all the volunteers who work hard at raising these monies. They can be very proud when they see the results of their work today.
Good morning, my name is Jody Nesty, and I'm a board of directors with the Thunder Bay Health Sciences Foundation. I am happy to be here too today with Margaret to help announce some of the ideas that have been coming forward and were approved for funding in this year's Family Grants program. So we currently had, this year we had about 50 applications for different requests totaling $192,000. As you can imagine, it can be difficult to go through those applications, but I believe the committee did a fine job in selecting the ones that could provide the best care for our patients here at the hospital along with their families. And it's also inspiring to know that these little things do make a difference in patient-family care. So for now, we'd like to introduce or feature some of the 41 grants that were selected as being funded this year. So rehab patients in the hand clinic will be treated to a paraffin wax bath. They dip their hands in the wax and then put them inside insulating gloves that provide therapeutic relief from the pain of arthritis, joint inflammation, and muscle stiffness, as well as increase the circulation for them. These paraffin baths will also be used to treat elbow, feet, and shoulder injuries.
Family members of patients in the intensive care unit will have a new sleep chair, allowing them to stay close by their loved ones day and night and improving their own rest and coping.
Angioplasty patients in the cardiac cath lab will now have a 3D anatomical heart model as a visual guide to help them understand the anatomy of the heart and better appreciate their condition and their procedure that they'll be getting.
Likewise, an ostomy training mannequin will be available for the surgical areas for hands-on training for patients requiring a temporary or long-standing stoma following urinary or colorectal surgery. This will help patients to become comfortable and familiar with the products needed to care for themselves before being discharged.
Soon, the directories at the main entrances of the Health Sciences Center will include pictogram find-weighing signage. It'll make it easier for patients and visitors, especially those whose first language isn't English, to find their way through the hospital.
The lobby in the Health Science Center is being spruced up with new furniture. This furniture is a high-traffic resting place for people waiting for rides or appointments and for patients who want a change of view. It will now create a fresh, welcoming environment for patients and their visitors. Thank you.
And in the emergency department, we'll be receiving up to 8 grants just this year, totaling over $9,100. So I'll turn this part back over to Glenn so he can better describe the things that are happening in the ED department.
Thank you, Jody and Margaret. And as Jody's maybe too humble to say, Jody is our new vice chair of the Thunder Bay Regional Health Sciences Foundation Board of Directors. Our emergency department is about the second busiest in Canada, and every day they see hundreds of patients, as well as many patients have to stay there while they're waiting for a bed within the hospital. So the family care grant team really wanted to invest in the equipment to make that patient stay as best as possible. I'd now like to call in Keith Taylor. Keith is a volunteer, and it's hard to believe that he's a volunteer because I see him, I think, at more meetings than most of my colleagues. He is a very dedicated volunteer and our co-chair of the Patient Family Advisory Council to give their perspective. Keith?
Thanks, Glenn. So, as always, I'm going to try and represent the voice of the patient. And the first thing I thought about coming here today was one of the words we use around this hospital quite a bit, and that word is collaboration. We throw that word around all the time. The family care grants really are an example of how to use the word collaboration. I think of the players when it comes to family care grants, and I think about we start with the foundation, for example. Here's a group that every minute of every working day is spent raising money for one cause only, and that's to make improvements to the patient's stay here. That's their only purpose. And I think sometimes patients, we take the foundation for granted. So that's the first equation to this collaboration, and what a good piece of the equation. The second equation is I look at the Volunteer Association and the volunteers in general. I think I asked Liz one time, and I think our number is between 300 and 400 volunteers, somewhere in that range. Is that right, Liz? I mean, up. Talk about human equity and talk about horsepower. Roughly 400 people that come here every day with a smile on their face. And again, their only purpose is to make the patient stay better. What a team. Then we talk about really the third equation. When you talk about the family care grants, and it's the staff, the frontline staff, that actually come up with the needs because, they're there. They see what needs to be done. So here, I've got a list of the ED things that were, the grants paid for. And a lot of them are not ground-shattering pieces of equipment, but nonetheless, they're as important when you're down there. The staff sees the change, sees the need, and as we all know how busy we are down in the ED, things like tray tables so you can actually eat a meal while you're laying in a stretcher. Chairs, we take chairs for granted, but when you're down in ED and it's packed and there's nowhere for your family to sit, that chair is worth its weight in gold. And that's basically what's on this list, is things that make the patient and their family have a better experience here. And here we have a staff at the ED. We all know they're worked very hard. They're working in a pressure cooker environment, but yet take the time to figure out what the patient needs, what the patient's families need to make their stay better. So when you think about a collaborative approach to doing something, the family care grants really define that meaning. So speaking on behalf of patients and patient family advisors, I would love to thank the foundation, the volunteers, the Volunteer Association, and the staff here at the regional for making it so good here for patients. Thank you.
Keith, thank you very much for those very kind words. One of the very interesting and innovative family care grants was equipment for the ambulatory care unit. And as I know at first-hand experience, I was talking with some donors yesterday who are waiting in the fracture clinic, and how sometimes it can be a little bit off time, shall we say. And this new initiative is really going to help improve patient experience. And I'd now like to call on Don McLeod and Barb Rickards to explain this new program that's going to be in our ambulatory care clinic.
So hi, good morning. My name is Dawn McDonald. I manage the fracture clinic of one of the areas, so thank you. I just want to reinforce what Keith said about the foundation and raising funds. The initiative for the fracture clinic was actually brought to us from a patient who recommended that we have a paging system like they do in the restaurants and in some of the pharmacies in town, so that they don't have to sit and wait. So again, to the foundation, thank you. But it was on the suggestion of a patient and in support from our volunteers and our PFA that the initiative went through. So the fracture clinic, as everybody knows, is a very busy place. You probably noticed the full waiting room on your way up to the lobby here. Patients go to the fracture clinic who have had some kind of musculoskeletal or some type of bony injury or surgery to be assessed and treated there. You can ask the majority of patients that have had to go to the fracture clinic, and they'll tell you that there are usually long waits to be seen. Until recently, patients couldn't leave the waiting area for fear of missing their appointments. But now a new pager system is in place that gives patients more freedom to move around while they wait. And as Glenn mentioned, this system received a family care grant a few years ago, but there were some delays in trying to get the installation and testing of the system signal within the hospital environment. The page is now up and running, and we want patients to know that it's available to them when they visit the fracture clinic. And I guess the signal, it's time to hear from Barb to tell you some more about the benefits of the new system.
So because I don't need the aid of the fracture clinic, I guess my table's ready. Nonetheless, it's testimony to the patient family-centered care mantra that this hospital has listened to that patient. And because of the uncomfortableness of the waiting room, these pagers now are they're taking away the tether to that specific seat that they would be sitting in. Now they can go and they can visit an inpatient. They can go to our wonderful gift shop and spend some of their money. They can go down to the cafeteria. The range is extraordinary. Just don't leave and go out into the parking lot and try and have a cigarette. I'll tell you that right now. But nonetheless, the patients were the ones that said this will make the wait, which sometimes can be longer than what the hospital would like, make it more comfortable, allow us to move around the hospital and still be able to get back. I can feel it buzzing in my hand and I can hear it, so there's no point, or there's no concern that you're going to miss your appointment. The other thing the patients were interested in is, I don't want my name called out like that. So now the patient is anonymous. This just tells them to report back to the desk and their doctor is waiting. Thank you.
Thank you very much for that demonstration. And is it a table for two, or all of us? Or,
You buy the wine.
Maybe afternoon. This is a small thing, but it really shows that small things can make a huge difference. And as Barb pointed out, this was a patient-led initiative. And when we look back, since 2009, 200 family care grants have been funded. So that's 200 initiatives that have been brought forward by patient and frontline staff to help improve that quality of care. So again, a thank you to the Volunteer Association. Thank you to the employees of Thunder Bay Regional Health Sciences. So many of them, through their employee giving programs, have supported this program as well, because they see not only is this the place where they work, but this is the place where their family receives care. So thank you for coming out to the announcement today, and have a great day. Thank you.